Knock, knock. Hello, my name's Charlie. I'll be your student nurse today. I'm going to do some quick hand hygiene here, pull the curtain for some privacy. I'm here to just do a quick head-to-toe assessment, ask you a few questions, just kind of get a baseline medical assessment done on you. There's going to be some touching going on during this assessment, so in light of that, are there any cultural preferences that I need to be aware of? If you want someone else other than me doing this assessment, you okay with me touching you? Okay, good. My first question for you is I'm going to take your wrist here and look at your wristband. What is you say your first, last name, and date of birth?
Olivia Babini, May 19th, 1993.
Good, that matches that. And one of my other nurses already came in and took some of your vital signs, so I'm just going to quick ask you, are you having any pain right now? Where is your pain? Right there in your stomach? When did it start?
A little bit ago.
Alright, scale of 0 to 10, 0 being no pain, 10 being worst pain ever, what would you put? A 2. Does anything make it better or worse?
Heptobus makes it better.
Makes it better, okay. And is it a throbbing pain, stabbing pain, dull pain, or anything like that?
Like a dull pain.
A dull pain? Okay. So now I'm just going to kind of shine a light in your eyes and ask you a few silly questions, okay? Who are you?
Olivia.
And who am I?
Charlie.
Good. Where are you?
I'm at the hospital.
In what city are we in?
Coon Rapids.
What is the date today?
This is the 1st
Of what month?
December.
Good. What day of the week are we in?
Tuesday.
What year is it?
2020.
Who is the president?
Donald Trump.
Good. And why are you here at the hospital?
I have stomach pain.
Yes, done. Okay. So I'm just gonna, as I said, I'm just gonna ask you a few questions, gonna explain to you everything I'm doing as I'm doing it. First thing I'm gonna do is I'm gonna check your pupil size, okay? Just look straight forward. Pupils are 5 on each side, nice and equal, they're round. The next thing I'm gonna do is I'm gonna shine a light in your eyes just to see how they react, okay? Good. Good. And then I need you to look at the tip of my pen, and look at the back wall, and then look at the tip of my pen. I'm just making sure your pupils constrict and dilate appropriately as you look at different distances. And I need you to follow the tip of my pen with your eyes. Good. Good. Diagonally. And the other way. Good. Your ocular movements are good. And the last thing I need you to do, I'm going to do is test your peripheral vision. Okay, so once the head look straight, tell me when you see the pen. Good. Do the other side. Perfect. So then I'm going to check your temporal pulse here. Good. I'm going to check your carotid pulse as well. Good. Good. Then I'm going to check the inside of your mouth. Open your mouth for me. Good. I'm also going to shine it into your nose. Good. And your skin also looks good. It's a nice temperature. It's good color. You're not cyanotic or anything. It's nice and pink and warm. I don't see any lesions or anything like that, or edema or swelling on your face. Your hair looks good. It looks nice and washed. Doesn't look dirty or anything like that. You also seem to be in good mood. You don't seem to be in any distress or anything like that. You're alert oriented, talking to me appropriately. And then I'm going to check your brachial pulses here on the inside of the crook here. Okay. Nice and strong and equal on both sides. Same thing down here to radial pulse by your wrists. Nice, strong, and equal on both sides. I need you to squeeze my fingers as hard as you can. Good. And then I need you to stick your hands out like this. We're going to check your capillary refill. Good. It should be less than 3 seconds, and it is. Can you close your eyes for me, Olivia? Can you feel that? What am I doing?
Tickling marrows.
Perfect. And then I need you to put your hands out like this. Push against my hands. Pull back. Pull back. And don't notice any swelling or edema or any lesions on your arms. The skin is good, pink and warm on your hands as well. And now I'm gonna just listen to some lung sounds real quick, okay? I'm gonna move some of my equipment around. Can you sit up for me at the back of the bed there? Good. I'm gonna do the front first. If you would do me a favor and just move your hair to the back. Good. So I'm going to listen on the top here, and on the top I'm going to be listening for bronchial sounds, and I'm going to move to the middle where I'm going to be listening for bronchial vesicular sounds, and those are heard in the middle of your lungs. And then I'm going to also listen to the bottom, which are vesicular sounds at the bottom, at the base of your lungs, okay? Good, perfect. Then we're going to switch to the back. Good. Lungs sound good. If you'd lean back for me, now I'm going to listen to your heart. All right. Over here a little bit here. First, I'm going to be listening in the second intercostal space, right sternal border. I'm going to be listening for your aortic valve open and close. We're going to move to the left sternal border, second intercostal space, listening to your pulmonic valve open and close. Then we're going to move to the fifth intercostal space, left sternal border, and listening for your tricuspid valve open and close. And then we'll move to the fifth intercostal space, midclavicular line right here underneath your left breast to listen to the mitral valve open and close and listen to your apical pulse. Sounds good? All right. You have a shirt on underneath your sweatshirt, Olivia? Good. If you could pull up your sweatshirt just a little bit, you can leave your shirt down. I'm going to be looking at your abdomen here. I don't see any distension or anything like that. Don't see any skin breakdown or anything like that. Are you having any concerns regarding bowel movements or anything like that? How often do you have a bowel movement?
Every day.
Every day. What is is it just soft and firm? Is it black and tarry or really loose or anything like that? Soft and firm. What was your last bowel movement?
Today.
Today? You remember what time about?
10.
10? Okay. All right. I'm going to listen to your bowel sounds here, okay? The normal rated bowel sounds is about 5, every 5 or 10 seconds I should hear one. Good. Good. Go right underneath your waistband here real quick. And I'm also going to go to the other side right underneath your waistband real quick. Good. Then I'm just going to lightly palpate. It shouldn't be painful or anything like that. If it is, just let me know, okay? Is that painful at all for you? Good. I didn't notice any, masses or any pulsating masses or anything like that. Nothing abnormal. Are you having any concerns with your urination at all? No? How often would you say you void your bladder?
Every few hours.
Every few hours? Okay. And is there any burning or pain that goes along with it? Okay. And any odors or anything like that? Okay. What color is your urine?
Yellow.
Yellow? Okay. Then I'm going to move to below your belt here. I'm not going to check your femoral pulse, but I am going to check your popliteal pulse here behind your knees. Good, equal and strong on both sides. Excellent. Now we're going to move down here to your posterior tibial pulse right behind your ankle bone. Good, nice and strong on both sides. Now we're going to move to your pedal pulse. Good, nice and strong on both sides. And I'm going to check your capillary refill, which should be less than 3 seconds. And it is. Good. And then I'm going to need you to close your eyes for me real quick. And can you feel me doing, what am I doing? All right, good. You can feel it, right? Mm-hmm. Good. And then I need you to pull your toes up towards your face and stand on your tippy toes. Good deal. And the last thing I need to ask you is, I actually don't think I need to ask anything down here anymore. Good. The next thing I need you to do is we're going to test your balance and your coordination and your gait. So what I need you to do is I need you to sit at the edge of the bed for me. Perfect. Feeling dizzy at all? No? Good. You can stand up for me? Good. Feeling dizzy at all? Good. And the next thing I need you to do is I need you to close your eyes and hold your arms out in front of you with your palms towards the sky like you're holding a box of pizza. Just hold your arms there. Watching for any arm drift or droop. Not seeing any, put your hands down. You can open your eyes, then I need you to repeat after me. Just copy what I'm doing. Good. Perfect. And then Olivia, can you go over there for me real quick? And then I just need you to walk towards me, nice and easy, looking, assessing your gait. You can turn around and walk back, looking for any limps, stumbles, nice even balance, nice even pace. Good deal. You can have a seat at the edge of your bed again. Do you have any questions for me at all, Olivia? I am done. No? Okay, I'm going to do some charting real quick, and then I'm going to let your provider know what I found, and they'll be in to speak with you as soon as they can. All right, good deal. Thank you.
Thank you.
Actually, you know what? I forgot one more thing. Can you lay back down real quick for me? I'm just going to check the temperature of your feet. Feels good. Skin looks pink. Skin is nice and warm. I don't see any breakdown or anything, or lesions or edema or anything like that. And one more thing I forgot to ask. Do you take any laxatives or anything like that, or any over-the-counter medicines to help with bowel movements? No? You don't take fiber gummies or colace or anything like that?
Did you take a fiber?
You did take a fiber gummy. Okay, good. Then that is all the questions I have for you. I'm going to go let the provider know, make some documents in your document in your chart, okay? All right, thank you very much.